With Dr. Shikha Jain with UI Health. We're talking about this notion of autism potentially linked to acetaminophen, and really, is this true? Is there evidence that shows that this is indeed true? We want to thank you so much for being here.
Happy to be here as always.
This is like one of those controversial topics that people are talking about now. We know the Trump administration is supposed to make an announcement about this at 3 o'clock. What does the study that was put out by Mount Sinai, what does it show? And is there evidence linking the two without any questions, I guess?
So it's a great question. And, it's being discussed a lot. And we have seen an increase in autism in this country over the last several decades. And part of it is probably because we're understanding more about autism and how to diagnose it. I know when I was a kid, we weren't seeing as much of it because it was underdiagnosed. Now, the study that you're referencing, it really does not show a causation. There are no studies that currently show causation, meaning taking Tylenol during pregnancy causes an increased risk of autism. What this study is showing is there may be an association. And I want to point out the people who published this have actually said very clearly this data, this study, this information is not saying that Tylenol during pregnancy causes autism. What it's saying is there may be an association. The analogy that gets thrown out a lot is, in Chicago, it's hot. When it's hot, people eat more ice cream. When it's hot, crime rates also go up. Does that mean that eating ice cream causes an increase in crime? No. It's a similar concept when we talk about this association. Plus, about 45 to 60% of women when they are pregnant do take Tylenol. And so if we really thought that there was true good data that showed that Tylenol caused autism, then it would be postulated that we would see even more autism than we're currently seeing. We just don't have the data right now to support a causation effect.
We are expecting the Trump administration to come out and say something about this at 3 o'clock, potentially linking the two. What do you think that our audience really needs to know? Because I remember when I was pregnant and I had some issues with, I think it was something with my heart specifically, and headaches, et cetera, and they told me it was safe to take Tylenol.
So I will tell you, I think, the audience who's seen me here before knows I have 3 children. I have twins, yes, and then an older daughter. I took Tylenol when I was pregnant. And the thing that's really important to remember is, why are you needing to take Tylenol, right? So if you have fevers, we know definitively that high fevers can cause complications. They can cause problems for the baby and also for the mom. We know that viral illnesses and other problems can cause birth defects and other challenges. So the question is, why is the person taking the Tylenol, right, and is it needed? And there have been so many really good randomized control studies and trials that have shown there are certain medications that are dangerous to use in pregnancy. For example, there are other medications that are used when you're not pregnant for pain, for fevers, that you should not be taking when you're pregnant. So I think it's important to remember that Tylenol is not just being taken for fun, it's being taken for a medical reason. And so when you're taking it, it could very well be that the underlying reason that you're taking the Tylenol could be causing complications as opposed to the Tylenol itself.
Let me ask you in particular about Tylenol. Is there ever a time when a mom, an expectant mom, is taking Tylenol consistently? I know, like for my case, it was a one and done type of situation. It wasn't like I consistently had to take it. I think I had to take it maybe for a week. Nobody's taking this long term, like 9 months of their pregnancy, right?
So there are some people who do require pain control throughout their pregnancy. But again, it's recommended, if you're going to need to take Tylenol, work with your doctor, with your obstetrician, and make sure that you're taking it at the appropriate dosage. There are some people who have chronic pain conditions, who have other challenges that they need to be taking some type of pain control throughout their pregnancy. So working with your doctor, with your healthcare team to make sure you're taking the appropriate doses is very important. The majority of people, like you or like me, would need to take it periodically. Like I ended up getting very sick during my pregnancy with my twins. I was having very high fevers, and my obstetrician said, absolutely, you need to take Tylenol. But it was under her guidance with the dosing that was appropriate, and it was for a short amount of time. So there are ways to take it long term if needed, and it's safer than some of the alternatives that are out there.